Hi, my name is Brett Hart, and I'm doing my presentation on diphtheria, specifically respiratory. There are two states, but during this presentation, I will strictly be talking about respiratory. Jumping right into it, we're looking at signs and symptoms. We have earlier and later. Unfortunately, earlier symptoms look more like influenza, but the later symptoms is where it becomes serious. You're looking at myocarditis, polyneuropathy, and paralysis, which is caused by meningitis and encephalitis. Unfortunately, these may or may not occur, and the sore throat is more of a definite. These may or may not occur depending on where it is. But you're looking at bull neck and pseudomembrane. These two are your most visual clinical manifestations of diphtheria, because bull neck is very large inflammation of the neck due to inflammation of the lymph nodes. And then pseudomembrane, well, we have a picture of it right here. This is a pseudomembrane coming off of the tonsil, a very common spot for it. What it is, it's comprised of just dead cells, toxins, some of the bacterium, and dead lymphocytes. Unfortunately, removal of this will cause bleeding because it's still highly vascularized. So you can't just remove it. This can go up into the nasopharynx, into the nasal cavity, and even into the nostrils. So this can be very detrimental to production of airflow. Moving on, we're looking at the pathogen itself. Corneobacterium diphtheriae is what causes diphtheria. There are three different strands: gravis, intermedius, and mitis. And then we have these four bacterium that have diphtheria-like syndromes. So then we're going to have to take a look at the microbiology of these, and then we can get a better idea of which one it is. But don't be fooled, these are not diphtheria. Moving on, virulent factors and pathogenesis. Endotoxins are what cause all the damage. The bacteria itself doesn't cause damage. As you can see, it's an AB toxin with active sites, but it acquires these active sites and lysogenic actions of the bacteriophage. Very interesting is it enters into the bacteriophage, multiplies, lyses the bacteriophage, and then it requires the gene that codes for the toxin, which then causes all the harm to the body. It inhibits protein synthesis, which is huge. Always leads to cell death. That's why no matter where it goes, whether it's the heart, you got myocarditis. If it's in the lungs, you got a lung infection like pneumonia. If it's in the nerves, you're looking at meningitis. It's detrimental. That's its main cause. Protein synthesis is huge. And then it's also contained by a suppressible operon. So all you need is more iron, and then it'll turn that operon off, and therefore it loses its pathogenicity. But as you saw earlier, the gravis stain is the most virulent because it can pull iron from your blood cells, which then lyse the blood cells, which could lead to a larger rate of lyse, and that's what causes your bull neck because of all the lymph nodes trying to take care of the cell debris. So moving on, we're looking at diagnosis. The first two are pretty simple, pretty routine. You got your PCR amplification and your ELISA tests, which count and figure out what's causing the problems, whether it's toxins or the bacteria. So that's kind of easy. But then this last one was rather interesting. Guinea pigs, and I don't understand it, but apparently sometimes they'll take the bacteria, pull it out of the patient, and put it into a guinea pig to watch to see for signs and symptoms of the same disease. This will take a while, so I don't know where this comes into practice, but it is one of the ways to diagnose it. Moving on, we're looking at treatments. Diphtheria antitoxin, or DAT, is really good if you administer as soon as you diagnose. And if you catch it early enough, it's the better, because it can attack it quicker and control damage. But unfortunately, if you don't, you have to have high portions of this through a long period of time to take care of the same problem that would have been taken care of earlier. Interesting fact, it is derived from horses. And then, of course, antibiotics can do the same thing. You're looking at penicillin and other antibiotics. This is more of a 14-day period before symptoms will finally start to fall. Moving on, you got prevention. You get the vaccine. That's pretty standard. It's a toxoid vaccine, which means it has been inactivated, but it still gets the immune response system to enact to it. So the primary response is done, and then you have your secondary response. So you got those T cells remembering exactly what it is, and for about 10 years. So then you get this every 10 years. And of course, the secondary prevention is just avoiding known diphtheria places that have endemics of diphtheria, because the developing world is still having issues with this. So, those two are the best ways of prevention. Moving on, epidemiology. So, as you can read here, in the U.S., it's very low. We standardize, get rid of it with vaccines. Standard vaccines make it to where we don't really have it as a problem. Only two from 2004 to 2015 cases. Only 2 cases reported. So that's probably nice. But most of the time, our cases are due to travelers going to other countries and then coming back. So, and then attracting it, because Russia is another big one that has endemics of diphtheria. So then when we look at it globally, you got 2014. That's 7,000 plus cases of diphtheria. Unfortunately, that is a low number when you look at Earth as a whole, but that's still a rather large number when it comes to diseases. We're going to try to cut that down using vaccines, trying to get it more like smallpox, where it was a thing and no longer is a thing. Unfortunately, the people that are affected are the younger than 5 and older than 40 population. So we got to kind of keep track of getting our children vaccinated, otherwise it's pointless. They're going to spread it themselves. And then my reference list. I've got 2 pages of it, and I'm going to send you a copy of this just in case you want to look it over. All right, thank you for your time.